Hi, and welcome to the show. Subscribe at kevinmd.com/podcast to get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Francisco Torres. He's an interventional physiatrist, and we're going to talk about his book, Beyond Diagnosis, Perspective in Medicine and the Human Experience. Francisco, welcome back to the show.
Thank you so much for having me again, Kevin.
So Francisco has been on multiple times. Go to kevinmd.com/podcast to search for his name, hear his story in prior episodes. But today, we're going to talk about his book, Beyond Diagnosis, Perspective in Medicine and the Human Experience. There's an excerpt on that on Kevin MD. So Francisco, tell us about your book.
Well, it's an interesting story because, for me, I've been a doctor for over 30 years now. And during that time, most of the time, I've been reading books about diet, nutrition, exercise, everything related to the medical field, more technical. And when the pandemic started, when COVID-19 hit us in 2020, I had more time. It was just more freedom to start using my head for additional thoughts. And I was confronted for the first time having to see patients through telemedicine. For me, that was new. I never done that besides a phone call. So my first patient, one of my patients during that time was kind of a little bit of shocking. This gentleman, in the middle of the interview, when I was doing the depression inventory scale test, he decided to pull out a pistol from his drawer.
Wow.
When I asked him if he had any thought about suicide. But the good thing at the end, when you look backward, he was just joking that the pistol was not charged. However, oh my goodness, all my cortisol level went up. I didn't know what to do. Yeah. And I said, the way I handled that at the end was because he was joking. He was just being himself. But then it kind of made me think, other doctors may have this possibility of encounter with patients that never thought about it. And then what do you do? So in that essay, which it was published in Doximity, and I won that award that year, was that I prepared the doctors, telling them one of the things I decided to do was to have direct access to my assistant in case of an emergency. Also, I told my assistant to get a phone number from a relative or a friend not in the house, and also to have a physical address if I had to send the police. Mm-hmm. So after that, I was more comfortable doing these interviews. But the other thing that it was shocking at that time was that, we are so concerned about diagnosis, to be sure that we have the right blood work, the test done. But when you see these people in their own home, how they live, how they dress, how they behave, it tells you that there is a psychology behind all these elements, and you need to pay attention. And that's what my first essay. And then after that, I say, I have so many stories. I start putting them together, and you were so kind to publish a lot of them. And I have had a really good reaction from many doctors.
So what are some of the themes that permeate throughout the book? So I think that your book, of course, is titled Perspective in Medicine and the Human Experience. So I think that you do want to focus on that human aspect of medicine, despite all the technologies that is advancing medicine. And you mentioned telemedicine, and now we have AI, and there's just so many technological influences that we have in healthcare that can sometimes affect that human experience.
Absolutely. And I think I see what I'm trying to is, my message is, technology is good. I do believe that artificial intelligence and technology like that are going to allow us to spend more time interacting with a patient rather than trying to guess the diagnosis and how we come up with a plan. So I think that's going to allow us to interact. But again, going back to experiences, I have to one of them was very shocking. I had this older lady. I treated both the husband and the wife for many years, and she lost her husband, after having a long course of dealing with lung cancer. And then she came to tell me that, and I apologize, but at that time I was a little bit in a hurry. I wanted to be sure I addressed her issue, but that was it. And she told me that she was going to run a marathon. And I look at her and say, you know what, in the late 60s, never exercised, never a runner physically. Well, I said, okay, good luck. Thinking, oh, yeah, she's not going to do it. And then later on, she came several months later. She was full of life. She was saying that she was running more. But then all of a sudden, she stopped me and said, Dr. Torres, the reason I wanted to run the marathon, it was not in my husband's honor. It was I wanted to kill myself. I was depressed. And then when she said that to me, wow, she used that to try, because she was, very religious. She didn't want to kill herself, but she thought that by stressing herself in a marathon, she was going to die. So it kind of made me think, you know what? I talked to that patient. It never crossed my mind about the possibility that she was depressed or suicidal.
Mm.
So that was an awakening.
So with all the non like the non-human aspects in medicine today, and we talked about technology a little bit, but now you have metrics and patient satisfaction and clinical best practices. How do you maintain that humanity in healthcare in the exam room?
It's a challenge every day. Particularly, we talk a lot about the burnout syndrome, and I think that burnout syndrome is the fact that we're seeing too many patients because with the reimbursement is going down, we need to compensate with volume the lack of reimbursement,
Hmm.
and also administration, and even now private equities buying out the clinics because we're all burned out. They want to get out of it, but then the private equity comes for the profit, not so much for the patient. So it's a challenge, I have to say. And if we're not mindful of what we're doing, I think we're gonna be having some issues later on. I was reading this statistic. The doctor's attention when he goes into a patient room, it's only 18 seconds before the doctor interrupts the patient. So
Hmm.
that patient only have 18 seconds to be sure he connects with that doctor. So that tells you.
So what do you do in the exam room knowing those statistics, and how do you maintain that
You know,
focus
I,
and human connection?
yeah, Kevin, I think I'm blessed because my personality, I'm very social. I try to keep the eye to eye contact. I am very touchy. Again, that is a little bit controversial, but I don't know why the patient give me hugs. And also I do procedures like electrodiagnostic study, which I have a bunch of stories from there, that you have to touch the patient with the electrodes and put a needle. So you spend 45 minutes with the patient in a room together. So there is a lot of, it's like a confessional. The
Yeah.
patients start more relaxed, and then get to the point that is your body language and the way you speak. We know that our words matter. So if they sense that you're in a hurry and you're not putting a little bit of effort to understand where they're coming from, I think that's when we fail.
In your excerpt, you talk about medical education and maybe incorporating some of the humanities to foster more empathetic and well-rounded physicians. So talk about how important it is for the humanities, especially in these new doctors that are coming up and medical students and residents.
Well, that's a great issue because one of the things I have medical students, I have fellows, and my understanding now is the university, the colleges, they are not promoting liberal arts. They even want to eliminate liberal arts. Many colleges are eliminating. They want to go to technical part,
Hmm.
mathematics, physics, biology, chemistry. So I think my experience with when I was going through college and exposing myself to psychology, to philosophy, and all these different matters that helped me to grow as a person, and I can interact with patients better. If I didn't have that, I don't think I would be the same person, the same doctor I am right now. And it's funny because there's a lot of people, motivational speakers, and people out there talking about the philosophers and going back to
Hmm.
that time. And I think in medicine, we're lacking that. I think it should be part of our curriculum to incorporate that.
So what are some of the other themes that connect the stories in your book?
Yeah, it's always a possibility that, like, for example, I had a personal one with my mother when she broke her hip, she went to the hospital. And I know I'm a doctor, but I didn't want to get involved in the care. But in my mind, it crossed the possibility of blood clots. But I was not strong enough to tell the doctors, be sure, because I thought they were taking care of that. The bottom line, I talk in that essay about intuition, that as a doctor, we have intuition and we need to pay attention to that, because my mother died from a blood clot, unfortunately. Again, it was not nobody's fault. But the funny part, Kevin, about all these essays is the reaction from doctors.
Mm.
They start questioning me and say, there's no intuition. Intuition is your knowledge and you have it in the back of your brain. But I said, no, that is what we're missing. Really, intuition doesn't have to be because we already have the knowledge. That helps. But it's something inside, that internal mechanism, that if we don't pay attention to it, we don't use it. So that's basically it. And then another one that I had, because I lost a couple of dear doctors in my life with cancer at a relatively young age and all that. And I talk about that I normally do every year. I go through I'm pretending I'm writing my own eulogy.
Hmm.
And I've said that because a lot of professionals do that as a norm. But the reaction from the doctors, Kevin, was that I was selfish. That don't think about your death, think about the patient death. I said, well,
Hmm.
you missed the point. It's just to be sure that you understand that life is very, very short, and that you need to pay attention to your surroundings. So that's it.
So let's get back to some of the things that you said about intuition. I thought it was pretty interesting. So what would be an example where you feel that intuition is being lost, and maybe talk about how intuition helped you with the care of a patient?
Well, many times, Kevin, it had been not proceeding with care of that patient because I felt like this is not, I'm not the right person. We're not connecting the right way. And at the end, it was a blessing, that I found, oh my God, not because there was anything particular about that interaction. It was just some feeling that I was uneasy with it. And I said, I'm not, the problem is, Kevin, that sometimes we can have fear, but that's different. That's a physiological. Intuition is more, I would say supernatural or more spiritual. I'm not saying fear about doing a procedure because you feel that you're going to fail. No, it's just something inside of you that I said, don't proceed with that, or call somebody at that time to see that patient, or have a consult or something. But if we don't pay attention to that, then I think we miss the opportunity to improve our clinical judgment.
So speaking of clinical judgment, you touched upon the physical exam in your Kevin and the excerpt, right? And
Yeah.
as you know, the physical exam isn't as thorough and is kind of going by the wayside because of time pressures. Sometimes it's easier to just order a test or send patient to a specialist because we only have 5 to 10 minutes with the patient in the exam room. Talk about how important a physical exam still is today, and how you use that to maintain connections with patients.
Well, I think the first part of the physical exam, you have to touch the patient. And that just showing that to the patient that you care, that you're not just not paying attention to the complaints. And the other thing is that I have seen patients that they had either a surgical scar that nobody saw, that all of a sudden when you're doing a procedure, I said, but nobody saw the patient that it has a surgical scar. We
Hmm.
had to figure that out when the patient's on the table for some type of injection or procedure, or that they have scoliosis. That's for me, that's the one that I see all the time. Then it kind of, I don't know, you feel like stupid that also in the x-ray, oh, I didn't know I have a scoliosis, but when you do the physical exam, and that's pretty obvious, you can see it and you can
Hmm.
tell the patient, oh, you have a scoliosis. So again, it's just establishing the trust between you and the patient. That's basically what I think the physical exam. I know that there are moments that they say, well, this doesn't help me, but at the same time, at least it helps you to rule out all the possibilities. The patient has a good range of motion of the arm, but doesn't have adhesive capsulitis or frozen shoulder, at least things like that, versus, oh yeah, the patient has pain, the x-ray shows arthritis. So again, give you credibility.
Tell me who the audience is for your book and what kind of messages you want them to come away with after reading it.
Was interesting because when I started writing them, it was mainly for doctors, to be
Hmm.
honest. It's just like a sharing, and it kind of worked because I have a couple of my colleagues telling me, "Oh my goodness, you have described things that happened to me, and I was not never read this before." Like when I went to Haiti for the mission work. Oh my goodness, I volunteered. I have all this, essay because I felt unprepared,
Hmm.
and all of a sudden, two doctors went through the same experience. So I was trying to say, well, if you read about it and you haven't done it yet, let's just prepare for that. So I'm giving you some heads up to go through that. So, but now I share with my patients, and they like it too. My patients we have a connection because of that too.
We're talking to Francisco Torres. He's an interventional physiatrist, and we're talking about his book, Beyond Diagnosis: Perspective in Medicine and the Human Experience. Francisco, will end as always with with your take-home messages to the Kevin MD audience.
I think that the main thing is to try to maintain that human connection in medicine, to do as much as we can, I know within our limitation, to at least pay attention to little details and establish sometimes eye-to-eye contact, a little bit of a touch, a hug, So specifically ask questions about their life as well, because I think that's part of the history. We're forgetting about getting a little bit of details about their family, social situations. I think that my idea, my purpose is to bring attention awareness that that needs to be done when you're interacting with, no matter if you do it in 5 minutes or 10 or 2 minutes. I really think we need to pay attention.
The book is called Beyond Diagnosis, Perspective in Medicine and the Human Experience. Francisco, thank you again for coming back on the show and sharing your time and perspective.
Thank you so much, Kevin. Appreciate it.